Hi, and welcome to another episode of the Healthcare India video and audio podcast. And uh, today I'm coming live from the health tech capital of India, which is Bangalore. In the last episode, I talked about a lot of factors which really were influencing the growth of healthcare in India. And these were essentially macroeconomic factors, including our savings rate as a percentage of GDP, our literacy levels, which have gone beyond 70%, and also the fact that almost 65% of our country is now people below 35 years of age. Actually, 50% is below 25 years of age. If you've missed all that, please go back to my first episode, which was a trailer, and which will give you a sense of the economic direction, the economics of what is driving healthcare in India. Today, I want to talk about access to care. And in access to care, there are two important factors. One, I want to talk about the demand side economics that is being played out in India, and the other thing is about technology. So first, we'll talk about the demand side economics. There is a lot of emphasis in healthcare on the supply side economics, and that's mostly around more hospitals, better lab facilities, more laboratories, more diagnostic centers, more primary health centers, district hospitals, etc. But for the first time in India, we are looking at the growth of what we call as demand side economics in healthcare. And that has been predominantly driven by a massive program, probably the largest public health insurance program called Ayushman Bharat, or popularly known as Pradhan Mantri Jan Arogya Yojana. When it was launched, there were a lot of questions as to how this will work and why this will work and who will benefit. But today, after all these years, we finally understood that more than 31 million people, 31 million procedures have been performed under this scheme, which is set to benefit almost 500 million people, those below the poverty line mostly. And today, the Ayushman Bharat program stands as a testament of how the demand side economics in healthcare is playing itself out. Interestingly, though the scheme is centered around those below the poverty line, almost 65% of the claims have come from private hospitals, and that too in urban areas. That means though a lot of our beneficiaries have been in the rural parts of the country, the procedures are still being conducted by private institutions in urban centers. A lot of government institutions have also been providing these services, including primary health centers, district hospitals, medical teaching hospitals, etc. And overall, what has happened is not only have the number of procedures gone up, but also the occupancy rates of these hospitals have gone up. Plus, there has been a tremendous growth in what is the revenue that is being accrued by government institutions. As a matter of fact, almost 30 to 40% of the revenue has gone to a lot of the government institutions who have no other way of raising funds. They have no other way of raising infrastructure. So what has this program created? It's created a movement in which care is being delivered primarily funded by the government. Well, there is a great move now to integrate wellness centers, and almost 80,000 leading up to 150,000 wellness centers, which are basically primary health centers that will be converted to wellness centers. That move has already begun. So at one stage, you have primary health care, your inpatient care being driven up, but also you have an opportunity now to create more wellness. And the counterbalance between the two is going to create a healthcare system that is fantastic. You might wonder that why is it that this story is evolving? Why is it so exciting? It's exciting because a lot of people who did not have access to care earlier now do. But does it mean we cover everybody? We don't. It is estimated that almost 70% of India is covered by some health insurance scheme or the other, whether it's Ayushman Bharat, CGHS, the state health programs, ESIC, defense, public sector programs, etc. But we still have a small amount that is not covered. Those just above the BPL, above the poverty line, and just below, affluent people. And now there's a move to even include gig workers who get about 15,000 to 25,000 a month into the scheme. Exciting days ahead. Very excited that we are doing this and talking to you about it. In the next episode, we're going to talk about how technology in healthcare is making a big difference in improving access to care. As always, do follow me on Twitter. I'm available at Dr. Vikram at Twitter. Do follow our Facebook page. Do follow our LinkedIn page. And watch out for more podcasts from me. This is Dr. Vikram Venkateswaran signing off from Bangalore. Thank you. Stay healthy.